Hello, it's Alan, and this is my approximately 1 year post-op top surgery video. I emphasize the approximately because when I posted my 1 year on T video like 5 days before my official 1 year date, people got upset about it, so it is like 8 days or something like that before my official 1 year post-op date, but why not make the video now? It's not like things are going to change drastically in 8 days. Yeah, so I had my surgery August 5th, 2014 with Dr. Crane and Dr. Satterwhite in the San Francisco Bay Area. And I've done a couple other previous update videos like about my keloid scars, so you can look back at those if you want, if you haven't yet. Okay, so, as I've said before, in general, I am very happy with stuff like the placement of the nipples and the incisions and the contour, but I've had bad scarring. I've had keloid scarring, according to Dr. Crane. So that has been really disheartening, really sucks. So let me show you a little. Sorry that I don't have an especially great camera. Clearly the scars are very red still. I think more red than most people's tend to be after a year. So that sucks, but it's gradually decreasing, especially this nipple has gotten lighter, and originally, pre-op, they were very pale, so I'm hoping that these dots go away eventually. And interestingly, I've had these dots of whatever the hell they are since the very beginning, like before the skin healed, like when it was raw. I had like dots of stuff, like I don't know if it was a scab or what, but it's still there, so hoping it'll go away someday. But it, in general, has gotten more pale, which is good. And then on the incisions, parts of it have gotten a little more pale in recent months, like this bit. This has gotten more pale. This, maybe a little here. So, it's very slowly making progress. And of course, the incisions are pretty wide because I had keloid scarring. And I think I had a lot of tension on the incisions because, maybe for a couple of reasons, because I did not have a very big chest, so it's like they barely had enough skin to make this method work, because I was like borderline of being able to do the keyhole procedure or the double incision procedure, and Dr. Crane thought that I would have better results doing the double incision, like that I was just a tiny bit too big for keyhole. So there must have been a lot of tension on the skin, like pulling on the incisions as I was healing, and then also I got surgery when I was just 2 months on T. So during this healing months, I was experiencing a lot of muscle growth, so I think that may have caused more tension on the incisions as well, maybe? That's my speculation. So yes, they're wide. Some bits are worse than others. This is the worst part. This is still a little bit raised in sort of a keloid fashion, but the whole thing is flatter than it was originally, because I had Dr. Satterwhite do the steroid injections into the incision scars, and it did really flatten them out quite a bit, which is really good, but it hurt horribly. I talked about that in a previous video. Let's see. So this nipple is not good. This one is quite a bit raised still. Can you see the side view? Not totally. So this one is still pretty much a blob. Not too happy with that. This one is more flush with my skin around the edges, which is good. And I feel as though maybe it's starting to have the actual nipple bit come back a little bit. I mean, not enough to show up in the video, sadly, but I feel like there might be a little something there coming back. 'Cause yeah, I mean, I don't have the actual nipple stick out parts yet. We'll see how that goes. Um, what else? Sensation. You know, it's weird because, well, this is pretty much what I've said before, but like, for a really light touch like that, I can't really feel it. Maybe I can feel it a little bit, but not really. So it's like some of the skin, like on the nipples and like right under, sort of around, like near the incision, it's pretty numb, at least on the surface. But of course, the muscle or whatever else that's just below the skin has sensation, or at least that's how I feel. So, like, if someone touches me with sort of a normal touch, as opposed to like a very light touch, I can totally feel that. And it's weird that even though the skin does feel a little bit numb, at the very same time, I still have some form of sensation that's hard to describe, and I do definitely still have erotic sensation, despite at the same time having some level of numbness. It's kind of strange, but I'm certainly happy to have some erotic sensation. So it's like it's weirdly possible to still have some erotic sensation even if the skin is a little numb. Well, I think that some of that is physical, like it's real, but then of course there's also the psychological component too. And it's really good to have somebody touch your proper manly chest. Other things. Well, I don't know if I have that much to add, really. I mean, it's not like there's a whole lot going on with it. Every day I'm consciously thankful that I got surgery. I mean, oh my god. Like, even if I would never feel comfortable taking off my shirt in public because of the scars, it's still worth it to me. Because even with wearing a shirt, it's like a million times better than not having the surgery. So I'm just so thankful. But I actually did take my shirt off very briefly in public when I was at a mountain lake recently near Yosemite. Although there were not many people around, and I tried to not let anybody see. I just had my shirt off for a little bit, and I was sitting like facing the water, but it still felt really good. And then when I was outdoors, totally by myself for a while, I did take my shirt off, put sunscreen on. That's very, very important because your scars can get really messed up in terms of color by the sun. But yeah, that felt really awesome. And I have been in the ocean. But I did wear a rash guard shirt because, as you might guess, I get burnt in about 2 seconds, even if I have sunscreen on. But someday I do want to go in the water without anything on top. You know, no shirt. I'm sure that'll happen eventually. I just hope that this crap fades somewhat, you know? Or I was thinking I could put on, like, waterproof makeup to try to hide them, like, if I go to the beach. But then I thought, how would it be possible to get makeup that's this white that would actually cover up these dark scars? It's like, do they make makeup that's that color? I don't know. Probably. Anyway, well, if you can think of questions, feel free to ask. I think Dr. Crane and Dr. Satterwhite are really good. Do I have anything else to add? I feel like that's probably it. Oh, well, one funny thing, which I think I might have mentioned before, but just in case, this is just amusing. So, you can see I have a little hair right there. Notice right in line with the nipple. And then also here, same thing. That is because where they did the incision, uh, like, this skin right here was originally just above my original nipple. So it's as if they cut this bit off and then sewed this to this. So, so this is my original nipple hairs that they saved, still there, just no longer on my nipple. So that's just kind of funny. Anyway, okay, I'll stop. That's my update. See you later. Thanks for watching.